Wegovy injection is now approved for adults with metabolic dysfunction-associated steatohepatitis and stage 2 or stage 3 liver fibrosis without cirrhosis. The approval targets a specific degree of liver scarring, not fatty liver alone. Body size does not determine eligibility, and neither does an ultrasound showing liver fat. Doctors need evidence of moderate or advanced fibrosis without cirrhosis. That stage determines who fits this indication. Metabolic dysfunction-associated steatohepatitis means liver fat is accompanied by liver cell injury and inflammation. Repeated injury and repair can produce scar tissue, called fibrosis. Cirrhosis is the most severe stage, with major structural changes throughout the liver. Fibrosis is usually described on a scale from stage 0 through stage 4. Stage 0 means no scarring, and stage 1 is mild. Stage 2 is moderate, stage 3 is advanced, and stage 4 is cirrhosis. The Food and Drug Administration approved Wegovy for the middle of that spectrum. The indication covers stage 2 or stage 3 fibrosis without cirrhosis. Mild fibrosis falls below the approved range, while cirrhosis falls outside it. In this group, Wegovy improved liver biopsy findings while also producing weight loss. Semaglutide reduces appetite and calorie intake by strengthening fullness signals. Weight loss can reduce liver fat, improve blood sugar, and lower metabolic stress on the liver. Fibrosis testing is especially important in higher risk groups. These include people with type 2 diabetes, obesity, high blood fats called triglycerides, abnormal cholesterol, or persistently elevated liver enzymes. These findings identify people who deserve closer liver assessment. Ultrasound can show liver fat, but it cannot reliably establish active steatohepatitis or the fibrosis stage. Liver enzymes have the same limitation. Significant scarring can exist even when enzyme levels are normal or only slightly elevated. A common first step uses a blood-based fibrosis score calculated from age, 2 liver enzymes, and the platelet count. The score estimates the chance of advanced scarring. A high or uncertain result usually leads to another test rather than an immediate prescription. The next test is often a painless liver stiffness scan that sends vibrations through the liver. Specialized blood tests or magnetic resonance imaging can also estimate fibrosis. These methods help separate low-risk disease from more advanced scarring. When results disagree, a liver specialist can review the pattern and exclude other causes of injury. A biopsy may be useful when uncertainty would change treatment. Biopsy removes a small tissue sample, so bleeding is possible, and the sample can miss disease elsewhere. The main Wegovy liver trial used biopsy-confirmed disease. Its planned analysis at 72 weeks included 800 participants with stage 2 or stage 3 fibrosis. Researchers compared Wegovy with an inactive placebo, while both groups also received lifestyle treatment. After 72 weeks, 63% of people receiving Wegovy had steatohepatitis resolve without worsening fibrosis. The same outcome occurred in 34% of people receiving placebo. That is a 29 percentage point difference between the groups overall. Fibrosis improvement was harder to achieve. At least one fibrosis stage improved without worsening steatohepatitis in 37% of the Wegovy group and 22% of the placebo group. Most treated participants did not improve by a full fibrosis stage. These two outcomes measure different things. The first asks whether active liver inflammation and injury resolved without worse scarring. The second asks whether scarring improved by at least one full stage without worsening the active liver disease. Weight changed alongside the liver findings. Participants receiving Wegovy lost an average of 10.5% of body weight, compared with 2% on placebo. The liver results reflect the combined effects of treatment, including weight loss and other drug effects. Weight loss is not the eligibility test. 7% of trial participants had a body mass index below 25. The prescribing information sets no minimum body mass index for this liver indication. Disease stage, not appearance, determines eligibility. More severe disease does not create broader eligibility. A person with cirrhosis is outside this Wegovy indication and needs a cirrhosis-specific plan. That evaluation includes checking for complications and arranging liver cancer screening. Doctors must also consider other causes of liver injury. Alcohol, hepatitis B or C, medication-related injury, and autoimmune liver disease can change the diagnosis. More than one liver condition can exist at the same time. Once diagnosis and fibrosis stage are clear, the Wegovy product matters. Only the once-weekly injection carries this liver indication. Wegovy tablets are approved for weight management and reducing heart and blood vessel risk in certain adults. The tablets are not approved to treat this liver disease. For the liver indication, the recommended maintenance dose is 2.4 milligrams by injection once weekly. If that dose is not tolerated, it can be reduced to 1.7 milligrams weekly. The dose can later be increased again to 2.4 milligrams. Dose escalation should not be rushed through persistent nausea or vomiting. If a dose is poorly tolerated during escalation, the next increase can be delayed for 4 weeks. Slower escalation can reduce dehydration from vomiting or diarrhea. Treatment still includes a reduced calorie diet and increased physical activity. Diabetes, high blood pressure, abnormal cholesterol, sleep apnea, and alcohol use also need attention. These problems can continue driving liver and heart risk after Wegovy begins. Safety screening matters before treatment. The prescribing information does not recommend combining Wegovy with another semaglutide product or medicine that activates glucagon-like peptide 1. It also should not be used with a personal or family history of medullary thyroid carcinoma. This is a rare thyroid cancer. The same restriction applies to multiple endocrine neoplasia syndrome type 2. This inherited disorder raises the risk of certain hormone-producing tumors. The restriction is separate from whether the liver disease itself meets the fibrosis requirement. Common side effects include nausea, diarrhea, vomiting, constipation, and abdominal pain. More serious problems include inflammation of the pancreas, gallbladder disease, severe digestive reactions, and kidney injury from dehydration. Persistent vomiting or severe abdominal pain deserves prompt medical attention. People using insulin or diabetes medicines that increase insulin release may need dose adjustments when Wegovy is added. The reason is simple. Combining these treatments can push blood sugar too low, especially as food intake and body weight fall. Pregnancy requires a separate safety decision because Wegovy may cause fetal harm, and advanced liver disease also carries pregnancy risks. Treatment during pregnancy is reserved for situations where the potential benefit justifies the potential fetal risk. Anyone planning pregnancy should discuss timing with the prescriber before conception. When pregnancy risk outweighs treatment benefit, Semaglutide should be discontinued at least 2 months before a planned pregnancy. This timing allows the drug level to fall before conception. For people who continue treatment, progress should not be judged by body weight alone. Clinicians may follow symptoms, liver enzymes, blood sugar, weight, and repeat fibrosis testing. Lower liver enzyme levels can be encouraging, while fibrosis still needs its own assessment. The accelerated approval is based on liver tissue improvements rather than proven long-term outcomes. The trial is planned for 240 weeks to test whether treatment reduces cirrhosis, liver failure complications, liver transplantation, or death. For now, the proven benefit is improvement in the biopsy-based liver outcomes measured at 72 weeks. Ask what evidence shows stage 2 or stage 3 fibrosis without cirrhosis. Bring laboratory results, imaging reports, medication lists, alcohol history, and diabetes records. Wegovy is approved for a defined liver disease stage, not for every person with fatty liver. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.